Welcome to the training for healthcare professionals. Let us learn about personal hygiene today. This lesson focuses on perineal care of patients. Let us take a look at the key learning objectives. After completing this lesson, you will be able to explain importance of patient hygiene, provide for patient's personal hygiene needs, demonstrate ways to provide perineal care to patient while maintaining patient's dignity and privacy. Perineal care is very important for the following patients: have urinary catheters, have had rectal or genital surgery, are menstruating, are incontinent of urine or feces, are uncircumcised. Being circumcised means the patient has foreskin covering the head of the penis. Let us now have an activity and find out which patient among the following would need help in perineal care. Select the correct option and click Submit. The items required for providing perineal care to patients are soap or other cleaning agent, wash clothes, bath towels, blanket, wash basin, gloves, protective sheet for bed. Let us understand how to provide perineal care to a male patient. Drag the seek bar to know more. Wash hands and wear gloves. Draw curtain for privacy. Take a washcloth and wet it with soap and water. Hold the patient's penis, wash and rinse the tip. Always wash from the small opening where the urine flows outward or towards the end of the penis. Wash, rinse and dry the shaft of the penis. If the individual is not circumcised, be sure the foreskin is pulled back. Wash, rinse and dry the penis. Return the foreskin to its natural position. Wash, rinse and dry the scrotum, the two sacs at the base of the penis. Clean between the skin folds in this area. Wash, rinse and dry the anal area, moving front to back, less contaminated to more contaminated. The procedure for providing perineal care to female patients involve the following steps. Wash hands and wear gloves. Draw curtain for privacy. Separate the folds of skin in the genitals, called labia, and using soap and the washcloth, wash with one downstroke the sides of the labia. Using a different side of the washcloth, wash down the middle of the labia. Rinse from front to back. Wash and rinse the anal area, moving front to back. Less contaminated to more contaminated area. Use a different part of the washcloth for each wipe. The following should be reported to the doctor immediately: bleeding, signs of skin breakdown or injury, discharge from the vagina or urinary tract, unusual odors, complaints of burning sensation during urination, any unusual observations. Some of the important points we should remember while providing perineal care are as follows. Always wash from the pubic area, front of the genitals to the anal area to prevent contaminating the urethral opening, where the urine comes out, with germs or bacteria from the anal area. Explain the procedure to the patient before beginning and during the procedure. Protect the patient's rights, dignity, privacy and confidentiality during the procedure. Handle the patient gently during the procedure. Take care of catheters and other support lines. Encourage the patient to do as much as he or she can for him or herself.
Once each day, or according to your doctor's instructions, you will need to clean the urethral meatus, the opening where the catheter enters the body. The procedure to do this is as follows. Wash and dry your hands. Discard the paper towel into the trash. On a tray covered with paper towels, assemble the following equipment: a pair of disposable gloves, a bed protector, a sealable plastic storage bag, a basin of warm water with a pump of liquid soap in it, 2 clean washcloths, and a clean hand towel. Place the equipment tray on a stable surface adjacent to the bed. Remove the bed covers, but keep the patient warm with a blanket. Wash and dry your hands. Put on your disposable gloves. Place the bed protector under the patient's thighs to keep the bed dry. Over your dominant hand, fold a washcloth into a mitt and squeeze it in the warm soapy water. For the female, separate the labia, the folds of skin surrounding the vulva. Clean one side of the labia with a warm soapy mitt, stroking from top to bottom. Squeeze the mitt in the soap solution and clean the other side. Squeeze the mitt in the soap solution and clean the first 4 inches of the catheter. Discard the mitt and dry the vulva and catheter with a clean towel. To make the patient more comfortable, the perineum and anus can now be cleaned. Use the second washcloth as a mitt. Wash from top to bottom, taking great care not to touch the previously washed areas and the catheter or tubes. Dry the area carefully with a towel, again avoiding the previously washed areas. Remove the bed protector. Check that the catheter and tubes are correctly placed. Remove your gloves and discard them into the plastic storage bag. Replace the bed covers. Take the equipment tray into the bathroom. Place the washcloths and towel into the washer. Seal the plastic bag and discard it into the trash. Clean the basin which held the warm soapy water and dry it with a paper towel. Wash and dry the bed protector. Wash and dry your hands.